Hey guys, we're live. It's Facebook Friday. I'm back. Talk to you a little bit about this the new ARRIVE trial that just came out about a month or two ago. So I'm going to run through the data on that. It has to do with a study that looked at inducing first-time moms between 39 and 40 weeks versus what we call expectant management. It was part of a maternal fetal medicines unit network study that involved 41 different hospitals across the country. And there were about 6,100 healthy first-time moms that were enrolled in this trial. And they were randomized to either being induced at 39 weeks or waiting until at least 40 weeks and 5 days to be induced. Looked at all the different outcomes that we would associate with induction to see if there was a benefit or a risk for either mom or baby. Maybe to some people's surprise, I don't think to my surprise, there were some really interesting findings. And the first big one was that the risk of C-section was actually lower in the group who was induced between 39 and 40. That's a big deal because a lot of people have wondered if induction of a first-time mom might increase the risk of a C-section. And it turned out in this study of, like I said, about 6,000 women, that was not the case. So this is this is the largest trial to date, really worldwide, that tries to answer this question. And I'm not going to pretend like this is the definitive end-all, be-all answer, but this is a lot of women randomized across 40 different hospitals across the country. The finding of a reduced risk of C-section by 16% is a big deal. And then the other interesting thing that I didn't necessarily anticipate was a reduction in the risk of preeclampsia and other blood pressure related issues for the mom by going ahead and being induced at 39 weeks. Those are two big findings that are actually really encouraging and, in my opinion, really change how we think about this. I think those are big. There's also the question as well, was there any harm to the baby? Was there any harm to the mom beyond just C-section rate? And it turns out there was not. And so they had what we call composite outcomes to look at mom or baby in terms of potential for harm. And there were no increased risks. And I'm just going to sort of run through those real quick. Well, first off, for the baby, there was about a 30% reduction in the risk of needing respiratory support. So, baby comes out, has some respiratory distress, has to have assistance in the NICU. So that was reduced by about 30% in the induction group, which is huge. And then just telling you what the fetal composite outcomes were, that there was no increased risk of in the induction group. Basically, respiratory distress, no increased risk of lower Apgars, no increased risk of meconium aspiration or birth trauma. And then for mom, there was obviously no increased risk of C-section. It was decreased. But there was also no increased risk of postpartum hemorrhage or infection either during labor or after labor. And the infection during labor, that's interesting. I wondered a bit about that because you figure first-time mom getting induced is probably going to have a longer labor, and that did turn out to be true. But fortunately, the study did not pick up any increased risk of infection. Obviously, like I said, not the end-all, be-all, but a well-designed study involving some 6,000 women across 40 different hospitals across the country. I'm happy to say that our group participated with a lot of patients in that trial, and Utah was one of the biggest producers of patients into that trial nationwide. So good job, everybody. If you participated, you helped forward our knowledge on this topic. So that's it that I wanted to tell you about the ARRIVE trial.